This video is an introduction for nurse educators to quality and safety education for nurses, also known as QSEN. Our intentions are to present a basic overview of the 6 QSEN competencies and their knowledge, skills, and attitudes, or KSAs, that educators should integrate into nursing curriculum. The challenge for nursing educators is adequately preparing students for entrance into the professional environment. The overall goal of QSEN and the purpose of this project is to equip nursing educators with the tools to prepare students with the KSAs necessary to improve the quality and safety of healthcare systems. The first competency in the QSEN initiative is that of patient-centered care, which is defined as the ability to recognize the patient or designee as the source of control and full partner in providing compassionate and coordinated care based on the respect of the patient's preferences, values, and needs. There are several dimensions of patient-centered care, including patient, family, and community preferences and values, coordination and integration of care, information, communication and education, physical comfort and emotional support, involvement of family and friends, and transition and continuity of care. Breaking patient-centered care down into knowledge, skills, and attitude dimensions will help students understand multiple aspects of patient-centered care and aid in the integration into the course. Planning activities where students discuss and examine topics such as patient culture, pain, and values, and family involvement, or barriers of involvement, will help the students in the knowledge domain. Skills of patient-centered care can be taught through group activities to promote open communication skills, practicing forms of physical and emotional support, and integrating patient and family wishes into the individualized care. Educators can help students realize the attitudes by recognizing and exploring their own attitudes, then trying to understand and respect others' attitudes in the context of their culture, values, and individual needs. Evidence-based practice integrates best current evidence with clinical expertise and patient or family preferences and values for the delivery of optimal health care. Educating students on the knowledge and importance of integration of evidence-based practice has been a priority in nursing education. It is important to help students find pertinent evidence-based practice and determine whether studies are reliable and applicable to the broad clinical situations to ensure best clinical practice. Students need to know that incorporating evidence-based research into their own practice will help them deliver the safest, most efficient, individualized care to their patients. Skills can be attained through individualizing patient care plans based on patient preferences and values, as well as evidence-based research. Practice finding, reading, and interpreting research articles will help students identify important concepts and analyze the reliability and validity of the studies. Focusing on attitudes, the educator should help students appreciate strengths and weaknesses of scientific evidence for nursing practice. Students need to be able to value evidence-based practice's role in quality and best clinical practice and the need for continual improvement based on this new knowledge. As novice nurses, they need to be knowledgeable of the importance of evidence-based best practice before deviating from them. Through the emphasis of teamwork and collaboration, students will learn to function effectively within nursing and interprofessional teams, fostering open communication, mutual respect, and shared decision-making to achieve quality patient care. Students must be knowledgeable of their own scope of practice and that of those around them. Activities that emphasize the importance of multidisciplinary teamwork will help prepare the students for professional collaboration in the workforce. Skills of improved communication and conflict resolution are important to support team building and group collaboration, as well as minimizing risks to patients. Educators teach the attitudes by helping students acknowledge their own potential as a valued contributing team member, and also value alternative perspectives and expertise of healthcare team members.
According to the creators of QSEN, quality improvement is the use of data to monitor the outcomes of care processes, as well as the use of improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. As educators, this means focusing the education of students on the knowledge related to quality improvement, including learning and understanding the area where they will work, recognizing the collaborative aspects of caring for a patient and family and how it can affect the outcomes for that patient and family, and recognizing the importance of changes in a workplace. The skills educators should teach are in regards to the nursing students understanding and knowing how to find information related to the outcomes of the care delivered, how to use tools and quality measures to identify gaps and variations in care, and the ability to design a test of change in daily work. The attitudes we as educators need to cover are the appreciation that quality improvement can add to daily work, the contributions and roles each of the students can have in their workplace, and finally, how the changes they can be part of offer better patient care and an improved environment. Safety minimizes risk of harm to patients and providers through system effectiveness and individual performance. Educators should teach nursing students the knowledge of human factors that contribute to unsafe practice, the technologies available that may reduce possible errors, and the factors in a workplace that can contribute to safe or unsafe care. The skills an educator should teach students are demonstrations of effective uses of technology, standardized practice, and communication to support a safe environment. The students should identify safe and unsafe practices and participate in analyzing errors. Educators should focus teaching strategies that cover the attitudes of safety, such as valuing and appreciating nursing's contributions and roles in safe practice, as well as the use of established safety guidelines that are set and implemented from a national level, and how they can use them in their individual professional practice. Informatics is the final QSEN competency and is the use of information and technology to communicate, manage knowledge, mitigate error, and support decision making. An educator covering this competency would focus nursing students on the knowledge of why information and technology skills are an important part of safe practice, identify what a database can contribute to patient care, and how technology is integral to that care. The skills an educator teaches nursing students are the application of technology in a healthcare setting, how a student can navigate and document in a patient's health record, and how a student can use information received and found to impact patient care. The attitudes include the appreciation of how technology provides information, continual learning, and error prevention for patients, valuing the role nursing plays in the use of informatics in the workplace, and demonstration of confidentiality related to that technology.